I was interested in in behavioral medicine, and before I was working in cancer, I was working in diabetes. When I moved over to oncology, there wasn't a lot of research in this area. So in 2005, we started a breast cancer survivorship program at Princess Margaret, and I moved over to work in that area a lot more.
I enjoy helping women that have been diagnosed with breast cancer. That to me is the fuel to keep going, just being able to help other women. Well, the Canadian Breast Cancer Foundation funded my research, and it was looking at the physical problems that women have after breast cancer treatment, to look at the accessibility and usage of rehabilitation services, and also to look at their lived experiences after breast cancer treatment.
CBCF has funded my research team for a new pilot study, which I'm really very excited about. It's called the iMove study. There's a lot of research now that's come out over the past sort of decade documenting a number of benefits of physical activity for women who have breast cancer. Women who are more physically active, both during and after treatment, have lower rates of cancer-related deaths.
First part of my research, I did a survey to breast cancer patients. Results of this survey were that 88% of the women that responded to the survey had at least one physical problem after their breast cancer treatment, and only 43% had any type of rehabilitation service after their breast cancer treatment.
iMove intervention is around sort of using an innovative approach, which is very much based on theories around behavior change and long-term behavior change, and harnessing new technologies like mobile apps, and using those together to really work on getting this long-term behavior change. And hopefully that means long-term improvements for these women in terms of their quality of life and overall survival.
I'm very excited about what's happening with research for breast cancer survivors, and I know it's going very well, but we certainly cannot stop now. I think there's still a lot of research that needs to be done, and some of those areas are looking at the best timing of when to institute rehabilitation services, and also looking at the participation outcomes of those that participate in rehabilitation services.
It's the breast cancer survivors actually that are, like, to me, there's such an energy there, like such a motivation to do something, support one another, raise money, however they're going to do it, but it's an incredible movement. So I thank people for that, because it allows me to certainly do the work that I love to do. And hopefully the work that I do will help to improve their lives.